Today we will learn about internuclear ophthalmoplagia. It is shortly called as INO. We will learn in following headings: introduction, then pathology, then etiology, then treatment. Now we will start with introduction. Now, what is internuclear ophthalmoplagia? It is an impairment in horizontal eye movements. This is uh, manifest as adduction defect in ipsilateral eye and nystagmus in contralateral eye. Means adduction defect in ipsilateral eye means your medial rectus is affected, and nystagmus is in contralateral eye is due to overfiring of your lateral rectus muscle. So for example, we are looking in this diagram. When you are looking straight, there is no any abnormality. When you are looking right, there is no any abnormality because your right side is not affected. But when your left side is affected, when you looking left, your medial rectus is not firing properly. So there is a no medial rectus movement in right eye, and your left eye is overfiring. So there is a nystagmus in your right eye. Now we will learn about pathology. There is a connection between medial rectus muscle and lateral rectus muscle as a MLF. This is called as medial longitudinal fasciculus. It connects both third and sixth nerve. So it helps or facilitate the lateral movements of eyes. Means your horizontal gait is controlled by medial longitudinal fasciculus. Okay, now we will see the connections. In this diagram, you will see your lateral rectus muscle is connected to your medial rectus muscle of contralateral eye with MLF. Okay, then this third nerve is give motor neuron to your medial rectus muscle. This is how this is work. If when you looking left side, your lateral rectus muscle is firing, it gives signal to MLF, then it is decussed to the contralateral side with the interneuron, which is originated from the sixth nerve, and which is give signal to the contralateral third nerve, so which innervate medial rectus. So medial rectus is also fire. So both eye looking towards left side. But when you see the pathology, you will see there is a lesion in the interneuron which is located in MLF, medial longitudinal fasciculus, which is innervate contralateral medial rectus muscle by third nerve. So what happened when you see left? Now we will talk about disease. When you look left, your lateral rectus muscle is firing, which gives signal via interneuron located in medial longitudinal fasciculus, which is not transferred due to pathology in interneuron of contralateral side. So what happened? Your medial recti is not firing. So your contralateral eye is not see medially. Means it is adduction defect. And due to this adduction defect, what happened? Your lateral rectus muscle is overfiring because you have to see left side, so your right eye also face towards left side to see the whole picture of universe, but it is not happen. So what your lateral rectus is giving signal to medial rectus via MLF, the fire, but it is not firing. So due to overfire of medial rectus, 6 now your contralateral side is showing nystagmus. So your left eye is showing nystagmus and your right eye seeing towards front because the medial rectus muscle is not firing at all. Now we will see the etiology of internuclear ophthalmoplagia. What is the reason behind this will happen? So there is a condition called multiple sclerosis. When you have demyelinating lesion in the brain stem, so your MLF is affected, so it will ultimately cause the internuclear ophthalmoplagia. Second is your brain stem infarction due to stroke, so it will leads to INO. And third is tumors, the tumors of third and fourth ventricle which compress the brain stem. You remember one tumor ependymoma which is originate from the lining of fourth ventricle. So you see when the tumor is enlarges, it will compress the brain stem, particularly pons. So it will leads to internuclear ophthalmoplasia. And what is the treatment option which is available? So generally we are doing conservative management for internuclear ophthalmoplasia. It will resolve within 6 to 12 months. But if it not happens, you can't do anything because this is degenerative pathology. You have to wait for regeneration or remyelination by your body. So you have other option, prism. So what it will do? Prism is getting rays from the medial side and it will send directly to your retina. So your eye do not have to actually look medially to see that view. So you will ultimately get view of medial side without adduction. So you have to prescribe prisms also. Thank you. If you like this video, please subscribe and like our channel and press the notification bell